I just look at the doorway for her to come in. I miss her so much. This is dangerous. It's a dangerous virus that comes going around. The virus took the baby away from me. By the time I woke up, the whole world was shut down.
In the back of my head, I was thinking, I won't catch it, I won't catch it. It's far away from me.
To say that we are living in third world conditions in America is true in a lot of senses.
What you have is a community that is set up to have, unfortunately, worse outcomes because of chronic underfunding of the health systems.
They have a federal responsibility. There's never enough funding that has crippled our response to the pandemic.
We were protecting our elders and protecting our culture and everything that is sacred to us.
Alcoholism, drug addiction, suicide, diabetes. These are modern-day monsters that are plaguing our people. Now we have a new monster, COVID-19.
Good evening from the Navajo Nation. I'm Colton Shone.
And I'm Nathan O'Neill. Thanks for joining us for this KOB-4 special, The People versus the Pandemic.
For months, the Navajo Nation has been fighting an invisible monster, COVID-19, a virus that's claimed lives and livelihoods.
The Navajo Nation was one of the first and hardest hit communities anywhere in the world. And still today, more people here are dying from COVID at a higher rate per capita than any state in the country.
In Navajo, Dineyazhe means the people.
And tonight we're sharing untold stories of tragedy, survival, and resilience.
She loved participating in pageants.
Crowns, sashes, titles are proudly on display in the Black Horse family home.
She would always enter at the last minute, and then she would get everything down within a week.
Valentina Blackhorse was fierce competition on the pageant circuit.
She loved her culture.
Always encouraging the traditional ways.
She used to talk about to the students or kids learn their language.
These snapshots bring bittersweet memories. Valentina is seen here smiling as she was crowned Miss Western Navajo. Her sister says she had big goals in life.
To one day become council delegate and maybe one day Navajo Nation president, because she always had that passion to help her people.
In April, the 28-year-old, seemingly healthy young mother contracted coronavirus. It started out mild.
I'm okay, Mom. It's just a cough. It's just a cough. It's just a cold.
Within a week, her health started to decline. She went to Kayenta Health Center for trouble breathing. Doctors made the call to send her to a hospital 150 miles away in Flagstaff, Arizona.
The last thing they updated with my mom was they're waiting for a helicopter to fly her out. And then about 20 minutes later, she got the call saying she passed away.
On April 23, 2020, COVID-19 took Valentina Blackhorse's life.
Some people say so-and-so fight their virus. They got out of it. They got well. What about my baby? What about her?
Months later, several Navajo communities are dealing with uncontrollable spread of the virus, and the death toll on the nation continues to rise. There have been more than 600 deaths since the virus struck, and roughly 1 in 14 Navajo people on the reservation has been infected.
60% of those who've lost their lives to COVID-19 here on Navajo are elderly.
At a military warehouse in Window Rock, Arizona, Navajo Nation President Jonathan Nez shows us how they're helping families fight the deadly virus he calls COVID monster.
This monster is sneaky.
Volunteers put together COVID care boxes for Navajo families filled with sanitizer, food, and other necessities to protect lives.
What are the weapons to combat this new monster? wear our mask. Matter of fact, we're wearing a weapon right now. We're wearing our armor.
Navajo Health Director Dr. Jill Jim has been tracking the virus and its spread on the nation.
I mean, it isn't going to stop until we get a vaccine. So there has to be a sense of urgency that these are made available, because there's a couple of days we have 0 deaths, but otherwise we still have deaths that are still happening.
Valentina's family believes quicker access to better health services may have saved her life. A big challenge for many living in the remotest parts on the reservation, especially dealing with an unpredictable virus.
I mean, it hits you hard very quick. You could be normal 6 hours before and then crash very quickly.
Valentina Blackhorse is someone who crashed quickly. Her death alone was surprising because she was so young. Laverne Blackhorse still struggles to accept life without her daughter.
I just look at the doorway for her to come in. I miss her so much.
But she knows that Valentina's legacy lives on in her 1-year-old daughter, Poet.
She just looked like her mom. She looks like her mom.
We know COVID-19 disproportionately affects Native American communities. Take New Mexico. Native Americans make up 1/3 of all cases, yet only represent about 10% of the state's entire population. The virus didn't create these inequities, but it did expose them like never before. In the early days of the pandemic, tribal leaders knew little about if and when the virus would spread on the Navajo Nation.
And one weekend alone, it spread quickly.
But near the northern edge of the reservation, Carol Totticini was one of the first to learn the virus was already here.
I had all kinds of things hooked up to me, and I didn't know what happened. I couldn't ask. In my mind, I'm yelling, help me, what happened? But I couldn't say the words.
The 60-year-old cancer survivor isn't sure where she contracted the virus, but she knew early on something was wrong. So she tried several times to get tested.
I got turned away twice. Test kits, they didn't have much test kits.
Days later, an ambulance rushed her to the Kayenta Health Center, a clinic that suffered from a shortage of both hospital beds and resources. And as Carol's condition got worse, there was no other option but to rush her nearly 300 miles away to a Phoenix area hospital.
So I was airlifted to Banner Hospital. Later they told me it was almost 3 weeks I was intubated or in my induced coma.
Carol still suffers from lingering side effects of the virus, but she has since returned to work managing transportation for the schools in town. While Carol is grateful she survived, she's also heartbroken because some of her coworkers did not.
5 of them, 5 mechanics, they all got COVID and 1 passed away. Emotionally, I guess you just have no will. You start thinking like, he has kids, he's still needed at home. Why am I still alive? I'm grown up, I live my life. I don't care for anybody at home. And this young man, he did. I just felt guilty in that way.
For years, the Navajo Nation has faced chronic underfunding of its healthcare systems, despite long-held treaties made with the federal government to provide healthcare. One shocking statistic, the Indian Health Service has only 14 ICU beds on the Navajo Nation, serving more than 170,000 people across 3 states. Navajo Health Director Dr. Jill Jim says the pandemic has highlighted the inequalities in healthcare as COVID patients on the Navajo Nation face staggering death rates.
There's never enough funding, and I think that has crippled our response to the pandemic. The inability to have updated electronic health records, updated health facilities, enough staffing, enough money for staffing.
In Gallup, New Mexico, medical volunteers are working to fill the healthcare gap.
How you doing today?
I'm doing okay.
You mind if we just chat a little bit? I'm gonna take your vitals and see how everything's going.
Physicians like Dr. Samuel Hatfield from the University of California, San Francisco, make their rounds through the halls of this hotel, which has been converted into a temporary isolation center for COVID-positive patients.
It's a community that medically has been neglected for a very long time. Really what you have is a community that is set up to have, unfortunately, worse outcomes because of chronic underfunding of the health systems here and higher rates of diabetes, hypertension, obesity.
We met Herman Francis toward the end of his 3-week isolation.
So you were wearing masks and you still got it?
We still got it.
Herman suspects he contracted the virus at a family funeral.
In the back of my head, I was thinking, I won't catch it, I won't catch it. It's far away from me. I'm always home. Here I am.
And while the Navajo Nation has some projects in the pipeline for new and improved medical facilities, it likely won't be enough. For now, Navajo people will continue to rely on outside medical help.
I don't think our healthcare system is still capable of managing the response without some of these volunteers.
A critical tool in fighting back against the virus and helping patients like Herman Francis survive.
This virus can really put you down, health-wise, physically, and mentally. Let's all come together and beat this virus. Yes, we can't see it, but it's out there.
Coming up, the people overlooked. Why tribal leaders say being left out repeatedly by D.C. may have cost lives historically and present day. When Native Americans made first contact with European colonists, their way of life changed. The federal government even suppressed their culture, which has left a lasting impact. Now tribes are fighting to keep their ways alive and refuse to be left behind. Allie Young has become one of the fiercest warriors against COVID monster on the Navajo Nation. She launched the group Protect the Sacred, which is backed by many high-profile celebrities, urging the Navajo people to stay strong during this fight.
Navajo strong. Navajo strong. Navajo strong.
Young believes Native Americans were already vulnerable to fight the virus before the pandemic through historical trauma.
To me, it's always important to find the root of an issue.
She says government assimilation tactics, including the takeover of Indian lands, relocation of Native people, and the extraction of minerals from sacred sites have all taken a toll.
There was uranium mining, coal mining for decades. Our people became dependent on coal and how that affects us internally. Lung diseases, respiratory issues.
A recent study published in the Journal of Public Health Management and Practice says assimilation policies and colonial expansion contributed to inequalities on reservations through the lens of COVID, such as chronic underfunding for tribes outlined in treaties, health information not given in Native American languages. Tribal officials point out their people were once again forgotten by D.C. leaders by not being included in the initial CARES Act legislation to fight the virus.
There was not one penny allocated to the 574 tribes.
Ultimately, tribes had to fight for their share, $8 billion.
Why does the federal government have that responsibility?
Well, through the treaties, of course. I mean, we've given up our lands and we've come back here and it's all part of history.
Young says the pandemic ignited a fire across Indian country to prove the nation's first people are still here, upholding cultural values, beliefs, and traditions.
Our first breath is like a political statement because we survived. We were supposed to be wiped out and we survived it.
Earlier this year, coronavirus hit the Navajo Nation like a tidal wave. The tribal government was forced to fight for $714 million in coronavirus relief money approved by Congress. That money was held up for months as the Navajo Nation fought the White House to keep that money away from corporations in Alaska. And after a court battle, the nation got that money more than 80 days late. Now, a deadline looms. Spend the money or give it back. When federal help finally made it to the Navajo Nation, in many cases, it came too late. Now, tribal leaders are forced to make some pretty tough decisions, especially as some people lack basic necessities, which is complicating the fight against the virus. Inside a warehouse in Window Rock, Arizona, a rare look at the vast amount of COVID-fighting supplies stocked up for the Navajo Nation. This is a stark difference from what public health officials saw at the start of the pandemic.
We really didn't have enough resources from the federal government.
Stacked on wooden pallets, we find massive stockpiles of hand sanitizers, personal protective equipment, and non-perishable foods.
Some of the food, yeah, of course, they'll go to...
Navajo Nation President Jonathan Nez tells us many of these supplies arrived months after the Navajo Nation became the nation's hotspot for COVID-19.
We had to wait and wait and wait. And the resources were after the fact. But now we're putting a lot of those monies for infrastructure, water line, electricity, broadband, telecommunication.
Water is one of the key challenges complicating the fight against the virus here on Navajo Nation. And while water is key to hygiene, for many living here, it's also scarce. On a hilltop in Red Rock, New Mexico, we meet 82-year-old Lee Wilson. He's lived here quite a while.
Long time, 1946.
His family friend Charlie Bowie looks after him. They both rely on water deliveries to survive.
He's supposed to have running water a long time ago now. Long time ago.
He says rationing the water from these barrels will hopefully last them a month. Inside Charlie's home, we find reminders of the pandemic hanging from a rusty nail. He shows us the metal bucket and the wood stove where he heats up water, just so he can wash his hands. In Gallup, New Mexico, a team of volunteers is racing to help those without running water. Here, they unload 275-gallon tanks, which are all bound for Navajo families. Manning the forklift is Zol Zani. He started Water Warriors United when COVID-19 first hit the Navajo people.
Health is the first and foremost reason people can't wash their hands without water. Everybody's being told to wash their hands, to stay clean, stay sanitary, wash dishes, and things like that. And if you don't have water, you can't do any of it.
On the Navajo Nation, roughly 30% of the homes here do not have running water. That's left many people relying on the help of others, like the Water Warriors, to help fight back against COVID-19. Every day, they haul tanks of water to the far reaches of the reservation, to families who need it.
It's hard. It's really hard without running water.
32-year-old Brandon Brown lives on his family's land. He hauls water every few days from Gallup, but sometimes the dirt roads become impassable.
I mean, these roads get really bad in the winter when it rains.
During the pandemic, others have had to learn to adjust. Michelle Jefferson built this makeshift hand-washing station, which sits right outside her home.
To my family and my kids, it's really important to wash our hands, try to keep this place clean.
The Navajo tribal government has earmarked $130 million in federal CARES Act funding specifically for water projects. But there are limitations.
We're not going to be able to help everybody.
Navajo Nation President Jonathan Nez tells us between federal government red tape and the December 30th deadline set by the feds to spend the money, those much-needed water projects likely won't reach those who need it most.
We would love to have major projects that would extend a water line to other communities and get more people water, but because of the deadline, we're just going to have to include those that live within a short distance from a major water line.
Which is why Zol and his team are expanding their operations. These massive water tanks will soon be delivered to elders to help them get through the winter and weather the pandemic.
To say that we are living in third world conditions in America is true in a lot of senses, but it's definitely something that can be fixed. So all we can do right now is hope for the best.
Coming up, fighting monsters, how the Navajo people are using traditional teachings to fend off the virus, and how they're looking to each other for strength.
The Navajo culture is deep-rooted in tradition.
And many say the virus is just one of many modern-day monsters they need to fight off to survive.
The creation story for the Navajo people is one where twin warriors slay monsters that are hurting our people. The virus is another monster that we will overcome.
President Jonathan Nez hopes using traditional perspectives will help inspire his people to fight current-day monsters.
Modern-day monsters today are alcoholism, drug addiction, suicide, diabetes, cardiovascular disease.
Hey, Gerald.
Fighting some of those monsters is Gerald Chi. He's recovering from his coronavirus diagnosis and alcoholism.
I'm tired of drinking.
He spent his time fighting the virus in isolation. Doctors here gave Chi and dozens of others the option to go to rehab to treat their alcoholism.
We know what's going on about the virus and everything. We try to keep our hands clean.
At the Scallop Treatment Center, Dr. Kevin Foley says widespread alcohol abuse helped fuel the virus like wildfire.
People are walking around in the streets, they're not social distancing, they're not wearing masks, they're sharing alcohol with each other, they're shaking hands, and it just exploded, the amount of people getting new COVID.
He says the pandemic has highlighted other socioeconomic challenges for the Navajo people, including unemployment. According to The Nation, 50% of the people here don't have jobs. The average household income is just over $8,200, well below federal poverty guidelines.
But there's always a need here. There's an extreme need, actually.
As for Chi, he says surviving COVID gave him new perspective to battle his monsters.
Start thinking about your life, man. You want to live, you want to die. I don't want to die. I want to live, you know.
Here on Navajo Nation, the fight against COVID monster is far from over.
But for now, the people here find strength in their culture, their past, and each other.
Our native communities have proved their resilience time and time again.
This is not a joke. It's real. It's really real.
Just try to protect yourselves and your family. Don't let your guard down. It's still here.
We've been here since time immemorial, and we'll be here well into the future because of that culture that we're protecting so much.
The idea is to keep them home, keep them safe, because the way we see it, when we lose our elders, we begin to lose a part of our culture.
What I've known about our people is that they'll never quit. We're going to persevere through this pandemic as well, and we'll be stronger from it.